All right, we're here again with Dr. Jay Isaac of Blackburn Primary Care. Thanks again for joining us, Doctor.
Thank you, Corey.
All right, so I guess right off the top, what sort of things have you been noticing in the last week or so, or since we've last talked? Changes in the practice, the number of patients you're seeing, et cetera, et cetera.
Mhm. Well, we're doing a lot of telehealth. So a lot of our sick visits, actually almost all our sick visits are through telemedicine. So it's video conferencing, et cetera. We're also, hearing a lot more about how to get the economy back on track. In other words, how do we get people back to work? And then finally, we're hearing about what kinds of people are primarily being affected. And it's not as simple as the elderly and people with heart disease or, kidney disease, et cetera. It's a lot more nuanced than that. But I can start with, what do you have to do to get people back to work and the economy rolling again, if you'd like.
Sure, please.
In order to get people back out there again, three things have to happen. One, you have to have the ability to test everybody. Two, you have to come up with something whereby you can mitigate the symptoms of the infection in people who are getting sick but not yet hospitalized. And three, you have to come up with some form of vaccination quickly. And that has to do with three things. So in any epidemic and pandemic, the three things that are important are how susceptible the population is, how much of the population is infected, and how much of the population is resistant. So if you consider the virus as a fire, the fresh firewood would be susceptible people. The ash would be the resistant people. The ash can't keep the fire going, but the fresh wood would keep the fire going. Now, one way to reduce the fire is to take the firewood and move it somewhere else so it can get access to the firewood. That's social distancing. But that takes a long time for the fire to burn out if you do it that way. But if you know who are all susceptible, who are infected, and who are not or who are resistant, you can continue social distancing some and get the others back to work because it's unlikely that they'll get reinfected. However, because it is a highly mutagenic virus, eventually resistance runs out. And hopefully by then we have an ability to create vaccines to keep it at bay, similar to what we do with influenza. So in order to get the economy going, we really have to get our ability for testing going. I do see a slight ramp up locally, but I'm still not satisfied with our ability to test. And everyone should be, if you are asymptomatic and want to be tested, you should be able to get tested. But right now, that's not the case.
And that's really important to find out if asymptomatic people are actually positive, right? Because they could be spreading it and we need to isolate them also.
Correct. But not only identifying people who are positive, also identifying people who have overcome the virus is also important.
Right, exactly. Yeah. But we are learning, I think, just in the past couple of days, I've seen some stunning articles that indicate a lot more people are walking around positive and they have no symptoms, right? Is that true?
That is true. There's a huge percent of people who are asymptomatic but shed, or people who have not yet become symptomatic that are pre-symptomatic and are shedding. And that's the difference between this virus and its cousin, SARS. So as you know, this virus is called SARS-CoV-2. The original SARS-CoV was very infectious, but people were symptomatic by the time they were shedding. So you could isolate them, and that's how we brought SARS under control so quickly. Whereas in this case, people are walking around asymptomatic or pre-symptomatic and shedding. And that's one of the reasons we have to have the ability to test everybody.
Right. That's why the testing is so important. Yeah.
Dr. Isaac, before we went on live a little earlier, you mentioned how the role of just bad health habits can play in a potential person suffering from disease.
Mm-hmm.
Can you talk about that a bit?
Yeah. So in New York City, one of the disturbing trends that that we've seen is that if you tend to be on the heavier side, obesity plays a huge part in responding poorly to this virus. And I don't think it's necessarily obesity per se, but what obesity does. So it creates a sort of metabolic dysfunction inside of you with your hormones, things like insulin and human growth factor. And of course, you know that that raises the risk for things like hypertension and diabetes. So if our health habits are poor, we're not, you know, healthy inside. Our quality of health is poor. So it's very important to pay attention to things like nutrition, exercise, stress. Why stress? Because it causes increased catecholamines and adrenalines and cortisol and all these hormones that just weaken your immunity and make you more predisposed to the complications of the virus. So this is a lesson, not just because of the virus, but just going forward, that if you're not paying attention to your health, if you're not eating healthy, if you're not sleeping well, if you're not managing stress and exercising, then overall you are exposing yourself to anything that comes by. You know, for example, you're more susceptible to influenza or the common cold. I had a patient once who was very unhealthy. He developed a cold, a normal cold virus, and developed heart failure from there. So, and that's not uncommon. So that's one thing we're seeing is as an unhealthy population, we are exposed to more of the complications of not just coronavirus, any kind of infection or other process, heart disease, et cetera, that comes along.
Right. Yeah. So all those factors are compromising someone's immune system.
Exactly.
Dr. Isaac, I've been reading a variety of stories on how it is transmitted. Recently, just this morning, there was an article about it's very likely that it can be transmitted through talking. And there is this, they use this example in this study of saying, stay healthy. And did you read this article? And the part apparently was like spreading the virus as fast and furious. Could you talk about these theories about how it's spread?
Well, it's spread primarily by, you know, it's an infection of the respiratory system. So how it gets around is the respiratory system. When you talk, when you breathe, there's a cloud of vapor and just material that comes out. That's just everyday stuff. And, you know, that carries whatever is in the lungs out with it, right? So if you cough, for example, yes, the heavier droplets will fall within 3 to 6 feet, but this vapor of particles, really small aerosolized particles, can contain the virus, and it can linger in the air. Now, if you have good ventilation, that's like our local Cumberland Farms has both doors open, and you can feel the ventilation. If you're in a room and you don't have good ventilation, it can linger in the air for hours. And so if I'm at Market Basket, oh, I don't mean to pick on Market Basket, I'm at a supermarket, and somebody coughs in an aisle, there's nobody else there, and they move on, and 10 minutes later I come along, some of that, you know, gaseous material is still there floating around with tiny little water particles containing virus. So that is one good reason. Well, the best reason to wear a mask when you go out is because you don't know if you have the virus, you don't want to spread it. But to a certain extent, wearing a mask might help you, although it's not as good a seal as a respirator. Having said that, the best way to prevent this kind of thing is if you test everybody, then you tell people who test positive, stay home. We'll deliver the food to you.
Right.
So yeah, it's not, it's all around us. You have to have a good ventilation system, but then it's also hand to mouth. Somebody sneezes or wipes their nose, and then they pick up some, fruit or vegetable, look at it, put it back, and then you come along and pick it up, and you transmitted the virus.
I scrub all my fruit pretty well.
Yeah.
So, soap and water.
Yeah.
You
Soap
had
and water.
several scares? Have you or your family members had any, have you had any concerns where you think you might have it? Has that impacted you at all?
Well, my wife still works in the office. She sees people who are well or for well visits. We're not allowing sick people in the office, but you never know. Someone who appears well may transmit it. And I do all my sick visits via telemedicine now. But it's easy for someone who's asymptomatic to spread it to her, for her to bring it home and be asymptomatic and spread it to me. So despite all the precautions we take, without testing everybody, there's no way of completely isolating.
Right. Yeah. No, that's just the scariest part of it, right?
Yeah.
That we just don't know.
Yeah.
Dr. Arns, I'm sorry. You feel as though we're going to be working on this and talking about this and dealing with this for well over a year.
I do. Absolutely. Because the nature of this virus and any virus like it that has achieved the ability to easily transmit human to human without a vector is that it can linger in some people, and as soon as you bring the susceptible people back out, you open the public to going back to work and everything, it roars back to life again, because now the susceptible people have now been exposed back to the infected people, and it's like a fire that's died down to an ember, and then you put the fresh wood on it, it just comes back to life. So in order to completely defeat it, I think up to 60% of the population have to have had it. And right now, only a fraction of the 7+ billion people on Earth have had it. So you can imagine that, I mean, unless we test everybody, there's no way to keep the infected and the susceptible apart. We can't see that. So, you can have these sort of rolling quarantines where you say, okay, look, it's dying down, we'll open the economy back up, and then it roars back, and then you quarantine, and then you open it back up, and so you can see sort of a rolling cycle for 18 months to 2 years, unless we can get, like I'd said, everybody tested and that vaccine out as quickly as possible. Then we can get back to normal sooner.
Right.
And I suppose if there is a silver lining to all of this, it's that all the testing that's being done now will serve us for the future in case something like this were to happen again.
Yes, I'm noticing that the way they're making vaccines is much more efficient. And I think, using the genetic material rather than growing the stuff in culture is going to allow us to adapt and respond more quickly in the future, because I do believe as long as we don't change our interaction with nature, that this is going to happen again. It's just evolution. These viruses didn't just happen. They've been living in bats for millions upon millions of years, and then we intrude into that ecology, and it's just adapting. It's evolution in action. So a virus is kind of like, at a very small level, evolution at work, but sped up. So it's the relationship between living things. We all have living things inside and on us that have taken eons to get into a balance. And I talk about this in one of my videos that I post, Blackburn Primary Care, on YouTube and Facebook, is that nature always seeks a balance. It doesn't want to, a parasite does not want to kill its host, then evolutionarily it'll come to a dead end. It wants to seek a balance. So this is new to us, and it's going to eventually find a balance. Like we have coronaviruses that are human or endemic in humans. There are 4 different coronaviruses. I'm sure when they first came out, they weren't so friendly, but nature works it out, you know? So there are trillions of viruses out there. Unless we want to, you know, keep exposing ourselves to the ecology of these viruses, we have to have some respect for nature. And it begins with things like actively regulating wet markets and places where you crowd humans and animals together. You know, we can't, and I don't see it as a war on a virus. It's what it is nature evolving based on opportunity.
Fascinating.
It is, yeah.
Good, Heather.
Well, my last question would be: are you reading any literature about the antibodies in plasma and any work with that? How is that coming along?
So, plasma is a very old treatment. You know, you take people who have recovered, and now they have antibodies to the thing, and this is a treatment you use in hospitals. It's not something that you would do outside of hospitals because you can have plasma reactions. But antibodies, you know, like IV antibodies, the antibodies that you give people through IV, are things we use for a lot of different kinds of diseases. I'm not very familiar with where they are with that, or if they're going anywhere with that for these kind of things for very sick hospitalized patients. But antibodies are useful for knowing who's acutely infected and who has resistance. So there are different kind of antibodies, some called IgM for acute infection. People who have acute infections have this kind of antibody. And people who've recovered usually have IgG antibodies for the virus or for any infection. And that's how you can see who now is resistant and can go back to work.
So the IgG would be people who maybe are asymptomatic, but they get tested and their blood is tested, they find antibodies. Is that right?
So IgG would be people who are already resistant to the virus. So they're good. IgM might tell you if somebody is infected but asymptomatic. But I think the polymerase chain reaction test for the RNA is a better test because sometimes you can have the infection and the IgM might lag. You might not have the IgM while you're, you know. So I think the genetic test is a far better test to know who's currently infected.
Okay. And that's what they do when you drive up to the place and they swab your nose. That's the test they're doing. Okay.
Correct. And that takes a few days. Now, the 20-minute test, that's the antibody test. And that test, has a higher false negative rate.
Interesting. Right.
Yeah.
So we could talk all day. This is so interesting. And I know the information is rolling out there. So thank you so much for sharing what you have with us.
You're welcome, Heather. It's been a pleasure.
All right. Be well, Dr. Isaac. We'll be in touch soon.
Thank you, Corey. Take care. Be safe.